Okay, let's talk about two of your body's most powerful and honestly most overlooked organs. In this explainer, we are diving deep into your kidneys, the real unsung heroes working inside you right now. To really kick things off, just look at this number. 45 gallons. That's how much blood your kidneys filter. Not in a week, not in a month, every single day. That is an absolutely mind-boggling amount of work. It's a feat of engineering that's happening 24/7. So the entire system, the whole renal system, is basically your body's own high-tech filtration plant. Think about it. Blood goes in, it gets scrubbed clean of all the waste and junk, and then fresh filtered blood gets sent right back out to keep everything running. It is a constant, crucial cycle. All right, so let's pull back the curtain and see exactly how these two little bean-shaped powerhouses actually pull off this incredible filtering job that literally keeps you alive. You can think of it like a 5-step journey. First, blood comes rushing into the kidneys. Then it hits these millions of tiny little workers called nephrons. Now, this is the brilliant part. These nephrons are smart. They're not just dumb filters. They grab the bad stuff, the waste, but they know to hang on to the good stuff, like vital nutrients and water. So in step 3, all those good things get reabsorbed back into your blood. The leftover junk, that gets sent to your bladder as urine. And finally, squeaky clean blood heads back out to do its thing. And this is the part that just, it blows my mind. We're not talking about a couple hundred of these filters. We are talking about millions of them, packed into each kidney. And they don't take breaks. They don't clock out. They are on the job 24/7, keeping you in balance. But here's the thing. Filtering is only half the battle. Your kidneys are also master chemists, performing this incredible, delicate balancing act to keep your body's internal chemistry perfectly tuned. See, your body is kind of like a complex chemical soup. And for everything to work right, from your heart beating to your nerves firing, all the ingredients have to be in perfect balance. Kidneys manage these key electrolytes you see here. You need calcium for your bones, potassium for your heart, sodium for your water balance. If any of these are out of whack, systems start to go haywire. And this slide really shows the chemical tightrope they walk every second. This is all about your blood's pH level. If it tips just a little too far one way, your blood becomes too acidic. That's called acidosis. If it tips the other way, it's too alkaline or basic. That's alkalosis. Both are dangerous, and your kidneys are working nonstop to make sure you stay in that perfect, life-sustaining sweet spot right in the middle. But of course, even our heroes can get overwhelmed sometimes. So let's take a look at some of the common problems that can really challenge the kidneys. First up is chronic kidney disease, or CKD. This isn't a sudden thing. It's a slow, progressive loss of kidney function over time. And what's behind it? Well, the two biggest culprits are usually diabetes and high blood pressure. Remember all those tiny, delicate nephron filters? Uncontrolled blood sugar and constant high pressure just grinds them down year after year until they can't do their job anymore. And then there are kidney stones. Ugh, just the name can make you cringe. Think of them as little, sharp rocks forming inside you. When certain minerals in your urine get too concentrated, they can crystallize into these hard deposits. And you might not even know you have one until your body tries to pass it. And that, as many people can tell you, is incredibly painful. Urinary tract infections, UTIs, are another really common issue. These are usually bacterial infections that start lower down in the bladder or urethra. But if you don't treat them, they can travel right up into the kidneys and cause a much more serious problem. And it's true, women are more likely to get them, just because of basic anatomy. And finally, let's talk about edema. You've probably seen this before, swelling in the hands, ankles, or feet. It's caused by excess fluid getting trapped in your body's tissues. And it's a huge warning sign that the body's fluid management system, with the kidneys as the star player, is failing. The plumbing is backing up. So what do we do when our kidneys are in trouble? Well, we don't just give up. We call for reinforcements. We bring in modern treatments and some pretty powerful drugs. For something as serious as advanced chronic kidney disease, it's often a two-pronged attack. On one side, you've got dialysis. This is basically a machine that acts as an artificial kidney, filtering your blood for you. And on the other side, you have drugs that manage all the side effects, like replacing lost nutrients or keeping blood pressure in check. A really important weapon in the medical arsenal, especially for that fluid buildup we saw with edema, is a class of drugs called diuretics. You might know them as water pills. Drugs like furosemide basically tell your kidneys to work overtime to flush out extra salt and water. It's a very direct way to relieve that pressure and swelling. Now, tackling kidney stones requires a whole strategy. First things first, pain relief. Then, for the bigger stones that won't pass on their own, a procedure called lithotripsy can use shock waves to literally blast them into smaller, passable pieces. There are even drugs, like tamsulosin, that can relax the tubes to make it easier for the fragments to pass. And for people who keep getting them, there are medications that can help prevent them from forming at all. And for UTIs, the treatment is usually pretty straightforward. Antibiotics for bacterial infections, antifungals for the rare fungal ones. But here is the single most important rule, and I can't stress this enough. You have to complete the full course of your medication, even if you start to feel better. If you stop early, you're just inviting the infection to come back stronger, and you risk creating drug-resistant bugs. So if we step back and look at the big picture, you can see how this all fits together. It's like a specialized toolkit. Medicine doesn't have just one hammer. For fluid retention, you grab a diuretic. For stones, maybe an alpha blocker. For an infection, an antibiotic. It's all about a targeted strategy, giving the kidneys support exactly where and when they need it most. So after all of this, what's the big takeaway? Well, your kidneys are amazing, but they're not invincible. And the good news is, you can be a hero for them. And it's not even that complicated. The two biggest things you can do: drink enough water and eat a healthy diet. Simple as that. Which really just leaves us with one final question to chew on. After seeing everything they do, all the filtering, the balancing, the nonstop work, are you giving your body's hardest working organs the support they actually need? Something to think about. Thanks for joining us.